Hi, Kate. It's Mariama here. I noticed that Joe's eye it's gone like all red, and it's got like some gross, sticky, like yellowy kind of stuff like coming out of it. I don't really know what to do. Do I put like some cream on it or something? I tried cleaning it, but it keeps coming back. I don't really know what to do. I'm a little worried about what's wrong with him. Can you tell me what to do, please?
Thank you for your call, Mariama. I understand your concern, and as mentioned, please continue with the hand hygiene and also the washing of the eye with the cold boiled water and to apply expressed breast milk after. If things escalate overnight with the breathing and if he's very unsettled, please go to the ED and I will come and visit you first thing in the morning, if okay with you. Okay? Eyes are a very delicate part of the body and it is also quite prone to infection if not looked after properly. Eye infections can occur in all stages of life and can vary from bacteria, fungi, or viruses. These infections can occur in different parts of the eye or both eyes at the same time. The signs and symptoms may include redness, itching, swelling, discharge, pain, or problems with vision. Depending on the type and the severity, treatment will be prescribed appropriately, for instance, compresses, eye drops, creams, and/or antibiotics, etc. This treatment will be commenced by other health professionals. To be more precise, neonatal conjunctivitis is a term generally referred to the red eye in a newborn, which is caused by infection, irritation, or blocked tear duct, and it is a serious bacterial infection due to gonorrhea, herpes, chlamydia, which is transferred from the mother during the delivery of the neonate. Viral neonatal conjunctivitis is uncommon, but if prenatally developed, could appear in the first weeks of life. For these reasons, both parents will require medical attention through referral to the sexual health clinic and reporting using notifiable disease guideline as appropriate. Conjunctivitis as a result of gonorrhea infection in the mother can be transmitted via infected genital secretion and appears on a neonate through contact of their eyes and often appears in the first 5 days of life. If untreated, it may lead to corneal ulceration and perforation, eventually leading to blindness. Chlamydial conjunctivitis in a neonate, on the other hand, tend to present later than gonorrhea and usually between 5 to 14 days of life, and also ranges in severity from mild redness of the conjunctiva with minimal watery discharge to severe redness and swelling of the lids, and conjunctiva with purulent discharge. It may be unilateral or bilateral. It may be associated with extraocular infections such as pneumonia in about 10 to 20% of the neonate.
Squeaky door opening sound.
It's Kate, the LMC. Following the phone call, Mariama consented to the visit to assess the condition of Joe's eye as discussed.
Hi, Kate. Thank you so much for coming. I really appreciate it. I did what you asked me last night, and oh my God, I think it really helped. Joe looks so much better than yesterday. Thank you for the advice.
It's okay, Miriama. I'm glad it worked out for you, but I would still like to have a look at Joe just to make sure everything is okay. I'm happy to see that you are more relaxed today. You're such a good mother. Good job. Thank you for listening to the advice.
I am observing Joe now. He is pale, alert, and well. Warm to touch. His temperature is normal. Breathing is 45 breaths per minute. His observation is normal. Only his right eye has sticky yellow discharge. Oh, Joe has just passed yellow stool and pee. Mariama, Joe is feeling well. Neonatal eye infection can be related to STI from the mother. Mariama, I have just looked at your maternal history. There is no indication of STI, but I will still need to take a bacterial culture swab from baby Joe to make sure he is not infected. For now, I would suggest you to continue with your hand hygiene when touching Joe and also to clean his eyes with cold boiled water regularly and gently massage his tear ducts. You can also add a few drops of expressed breast milk to the right eyes after cleaning. A warm compress to the eyes will also help relieve swelling and irritation. If the symptom is not getting better tomorrow or even worse, please let me know and we can discuss referral for Joe to GP for further treatment. If he is getting worse overnight, like fever and irregular breathing, please take Joe to the hospital immediately.
So, the purpose of referral. The point of referral, as according to the Ministry of Health, is that to promote and support coordinate of care across providers such as from midwifery to GP or to secondary or tertiary care so that we can safely provide maternity care with quality and improve consistency of the referral process so that the woman and her family can have the confidence if other care is required. In the referral guideline, there are principles that require primary health care, such as midwifery care, to use it as a way to protect the wahin, the woman, and her family. Such guideline below. The wahin, her pepe, and whānau are the center of all process and discussions. Communication between all practitioners need to have involvement of the wahin. The communication should be open, clear, timely, and appropriately documented. The wahin should have continual care through a single point of contact regardless of how her care are provided. In this case, it will be Kate who should be communicating with Miriama, notifying her the happening of all processes and when other services will come in contact if referrals are required. The wahin then has the right to make informed decisions on all aspects of her care, including the right to decline. Lastly, the wahin has the right to receive full and accurate, unbiased information about her options and the likely outcomes of her decisions. These guiding principles of the referral guidelines coincide really well with some of the Turanga Kopapa mechanism that Kate can integrate into her care for Mirama and Joe to give life and meaning in her midwifery care in this scenario, as according to New Zealand College of Midwife, the Handbook for Practice 2015. Some of the Turanga Kopapa that can be recognized example below. Whanau ngā tanga, which is allowing the involvement of Miriama and her whanau or other at the desire of Miriama during her time with Kate and other process. Whakapapa, Miriama and her whanau is acknowledged during the referral or when the referral are about to happen. Mana, which means Miriama and Joe as well as other involvement in Kate's dignity is upheld throughout the whole process. So this is like a partnership of both sides, from the woman and the midwife working together for the well-being of Joe in this case. Hoora, the physical, spiritual and emotional and mental well-being of Miriama and Joe is promoted and maintained throughout this process. Te whare tangata, Miriama is acknowledged, protected and nurtured and respected as the Te whare tangata, as the house of people under care or when referral process is required. Mana kitanga is when during the whole ordeal, it is Kate who she is the key person with a clear role and share with Miriama and her whanau the goal and the responsibility to carry out safe practice in caring for Miriama and Joe. This is also abiding to the midwifery partnership. The referral guideline in this situation where Kate finds that Joe sticky eye is not resolving on its own, or that when she examined him, there are abnormality detected, or that the swab result is abnormal, then as according to the Ministry of Health, the referral guideline 2012, Kate need to be in discussion with Miriama to refer Joe to primary care, such as their GP. If the swab result indicate HIV-related causation, then being the role of LMC, Kate need to recommend both Miriama and Joe to consult with their GP or other primary healthcare provider as indicated by the Ministry of Health 2012. The reason being is that postnatal diagnosis of HIV-related condition of mother and baby is not within the scope of midwifery to treat, and is not listed in the guidelines. So instead, Ministry of Health direct to seek primary care recommendation as indicated in section 4.1 of page 12 of the referral guidelines.
The prescribing of drugs within midwifery is defined under the midwifery scope of practice. Midwives practicing in New Zealand must prescribe drugs under their own responsibility and have appropriate knowledge regarding the effects, adverse effects, interactions, and contraindications of the drugs that they prescribe. The drugs prescribed must only be for use during pregnancy, labour, birth, and in the postnatal period up to 6 weeks. As a midwife, it is our responsibility to promote evidence-based care, which includes the drugs we prescribe. This ensures they are safe and effective as possible. Midwives are expected to understand, promote, and facilitate the process of pregnancy, childbirth, identifying complications that may arise in mother and her baby, and accessing any appropriate medical assistance or emergency measures as necessary, and in collaboration with other professionals as needed. There is no specific list of medicines a midwife may prescribe. However, the amendment in the 2011 Regulation 39 of the Medicine Regulations 1984 sets out the limits as to when a midwife can prescribe. Midwives are not expected to prescribe for all antenatal, labour, birth and postnatal situations, including medicines for the treatment of underlying conditions such as hypertension and asthma, but can prescribe vitamins and minerals such as vitamin K and iron, as well as local anesthetics, contraceptives, antibiotics, antibacterials, opioids, and the list goes on. However, in the care of a baby, a midwife's scope for prescribing is very limited. 0 to 11 weeks old is a critical time for infant development and therefore requires additional knowledge to prescribe for unwell neonates. This is due to the immaturity of their liver and renal system. Therefore, it is recommended to refer to a pediatric service or GP if in rural areas in cases that require further expertise in this area. Generally, antibiotics used for the treatment of conjunctivitis and superficial skin and cord infection in neonates. However, care must be taken to use topical antibiotics only when there is an infection present. As in many cases, sticky eyes in the first week of life is often related to an inflamed tear duct rather than an eye infection. This is why accurate diagnosis is crucial for neonates prior to administering any type of medication. And if for any reason a midwife is unsure, then best practice dictates that a referral should be made. A doctor's scope of practice is vastly more in-depth and intensive than that of a midwife, and therefore more appropriate for them to take the responsibility for diagnosing and prescribing for a neonate if this is required. However, a midwife must discuss with the woman if a consultation may be warranted with another relevant party, as her baby is or may be affected by a condition that would be better managed by or in conjunction with another primary provider. For a suspected eye infection in a full-term baby, swabs must first be taken to discount any condition causing this issue. Following the swabs, we can then recommend the use of saline drops, cooled boiled water while awaiting the results to provide some sort of relief, or alternatively, a small amount of breast milk can be used, as it has been proven to contain both anti-inflammatory and antimicrobial properties and can be used as a prophylactic measure in neonatal conjunctivitis. If it is established that the baby requires oral or IV antibiotics or paracetamol for the infection, then this would be outside of the midwifery scope of practice and a referral should be made to appropriate pediatric service or GP. Hi Kate, it's Miriama here. I'm just calling to let you know that Joe's eye looks so much better this morning. I did what you said and it seems to have really helped. I will still keep an eye on him as you recommended and will contact the GP and let you know if anything changes. Thanks again. I'll see you next week for his 1 week check.
Hey, not a problem, Miriama. I'm glad it's working out for you. But do remember to not hesitate to contact me if need be. Please also remember the red flags that we've discussed. For instance, if Joe appears restless, not feeding, having a fever, or if the eyes becomes sticky again, please do notify me, and always remember, if things changes dramatically or if I don't get back to you, please go to the GP or ED. All the best, and you're doing really well, Miriama. I will surely see you next week for Joy's 1 week check.